Okay. Welcome for the ones who wasn't here. Um, Actually, I'm a bit sick. So at the times you have difficulty understanding me, please stop me, okay? And sometimes maybe I can ask you to read some slides and I can comment on them. I didn't want to skip this class since you will have these topics in your midterm as well. So let's try our best, but please don't hesitate to stop me whenever you need, okay? Um, Huri, okay, I got your message. And let's start with ethical and legal issues. Are you able to see my screen now?
Yes, hocam.
Thank you for answering. Okay, let's briefly go through ethical and legal issues. Actually, you will have a total course on ethics on fourth grade. Hence, it will be a short, brief review of what ethical and legal issues in counseling is. Actually, this was the topic of our first week, but I didn't want to divide the psychoanalytic approach in your classes, so we skipped this topic. Now we are gonna mention about it. Just a second, I will check chat and okay, great. So let's go on. Okay, let's start with the definition of what ethics is. Actually, when we talk about ethics, we refer to the beliefs that individuals hold about what is right and what is wrong. Ethics is not just about the profession of counseling, it's everywhere in life. And its main concern is what we call or what is generally called right or wrong. And ethics are, in our profession, the general guidelines that are based on the basic principles of the counselor in the code of ethics. Actually, in Turkey, we have Turkish Psychological Counseling and Guidance Foundation, and they have just recently published a book on code of ethics. And this one is a very comprehensive one, and if you want, you can get it from the foundation. And actually, in US and in Europe, you will see that the code of ethics and legal issues regarding our profession are more complex and more comprehensive. Unfortunately, we don't have any laws in Turkey regarding the general borders and limitations of our profession. But this code of ethics, published by the foundation, is what we have for now, and we are trying to get utilized from it as much as we can, as much as we can. And while talking about ethics, especially in our profession, we are after the greatest benefit of people. Since we are working with people, we are responsible for them, and what we do should be for the sake and benefit of them. Okay? And let's come to the point why we need ethical principles. Actually, just maybe you already had some therapy or some counseling sessions with someone else, or maybe you didn't. But just imagine that a person decides and go to take a session with a counselor, with a professional. And maybe you can imagine it like going to a doctor and think that you may feel yourself in front of an authority figure. So, from the eye of a client, actually, you have the power. So, of course, this is not reflecting the reality. Of course, this is based on your theoretical approaches, what kind of a therapeutical stance you will have. especially as a professional, but by its nature, our profession requires an unbalanced relationship. And the relationship between the therapist, counselor, and the client is complicated. And take into consideration that we had talked about it in our first class while we were talking about the personal and professional characteristics of counselors. We are human beings and we have the right to make some mistakes and we are fallible, right? So these ethical principles are there to both protect us and our clients. Please stop me when you have any questions, okay? So, since we are talking about ethics, we are talking about boundaries as well. So, in the cases where there are limitations and boundaries, actually ethics play a role. So, let's talk about these boundaries. What are the roles of these boundaries in counseling? Actually, if you are having a client counselor relationship, you should have boundaries. Again, we had mentioned about this while we were talking about professional characteristics of counselors in our first lesson. Boundaries are important in order to protect ourselves and for our clients to protect themselves. And when you have boundaries, you will see that they set the structure for the relationship and they provide a consistent framework for the counseling process. Um, for example, we have some boundary lines which are very clear. For example, you cannot counsel your ex partner because you had sex with him or her, you had a love affair, and this pre existing relationship will inevitably impair your objectivity through your client. And you will have two roles there, as firstly as an ex-partner and now currently as a therapist. It's very difficult to distinguish between these two roles. So we want these boundaries. Uh, in this case, the boundary is that I cannot counsel my ex-partner. Okay, so ethics and boundaries protect us from complex relationships, dual relationships. And as you see here, boundaries are based on the principles of code of ethics. Actually, under the framework of this course, what you really need to know are the five principles Core outlines. Okay, and these five principles are important since therapeutic boundaries are based upon these five principles. First one is beneficence, and these are potential midterm questions. Okay, I may provide you a case where non-male fecunds, for example, was threatened, and I can ask you to um, determine which principle was ruined in that specific case. Okay, first let's talk about beneficence. Here, the most important thing is what we do is um, for the sake and goodness of our client. And a counselor must accept responsibility for promoting what is good for the client with the expectation that the client will benefit from the counseling sessions. The aim is for our clients to benefit from the counseling sessions. The second one is non maleficence, and this means doing no harm. Do no harm. Maybe you will do nothing, but do no harm. This is our critical point. And the counselor must avoid at all times any activities or situations with the client that could cause a conflict of interest. So be very careful about this, about not harming your client. Third one is autonomy. Maybe I had talked that sometimes we as counselors may develop some strong egos. Okay, our job, our profession um, provides us um, with a let's say what um, with a satisfaction since we can see the improvement and growth in our clients as we intervene. And sometimes we may over um, we may have some over those roles in terms of, let's say, giving advices to our clients, or to take responsibility for our clients for them to reach their goals. But what we need to remember is that actually our clients have the strength and resources to be able to think independently and to make decisions independently. So, what our responsibility is to encourage their strengths. This is our ethical responsibility. We will not take their roles in the process. And as long as our clients tend to be dependent on us, we need to be aware of this and instead trigger and foster their independency and autonomy, believing in their strengths and resources. And fourth principle on which therapeutic boundaries are based is justice. Um, as a counselor, you should be committed to provide an equal and fair service to all of your clients, regardless of their age, gender, race, culture, ethnicity, disability, or socioeconomic status. You should be fair and equal to every client you are counseling with. Okay? And the fifth principle is fidelity. You should be honest with your clients. Remember again from our first class about being honest. And please honor your client's commitment. Um, excuse me. Please honor your commitment to the client's progress. This means that you should be committed to your client's progress. You should be honest with your clients' progressive moments or the difficulties your client has been encountering. This is being honest, fidelity. Okay. And to mention about the ethical issues affecting clinical practice, we have some six um, most important issues that may interfere with your clinical practice, my friends. First one is therapist competence versus malpractice. Um, we had mentioned about this in our first class again. Therapists need to only provide services for which they are qualified. If you are not qualified, if you are not competent enough, you will injure and hurt and make harm to your client. If you are not, excuse me, if you are not competent, then refer your client to someone else. And second one is client welfare. Client needs come before counselor needs. And counselor must act in client's best interest. First, we will consider client welfare. Thirdly, we have informed consent. Informed consent is informing our clients about the nature of our counseling. I had again mentioned about this in our first class. What kind of an approach do I have? How long generally do my sessions take? What about the length of my sessions? 45 minutes, 50 minutes. What about the prices per session? Will I see my client each week or twice a week? Anyway, and my client will have questions about the process, the therapeutic counseling process, and I will be able to answer all of those questions honestly. And as a result, I will inform my client. And for these information I have mentioned, you will prepare a written agreement. And if anything in the first initial session arose, you will note them in that paper, in that agreement, and both you and your client will sign them. This means that client accepts that she or he has been informed about the process, and this means that you have met your responsibility for informing your client about the whole process. And we have um, anamnesis, excuse me, Koyes hocam netten düşünüyorum haber. Okay, Hande Hürü, thank you for informing me. And we have an anamnesis form where we take the history of our clients before they come to the session. And we get a general idea on their issue. So this form may provide us with the information whether we are feeling ourselves competent enough to be able to go on our sessions with that client. And as a result, let's say you are not competent enough, then again you will inform your client about that. Excuse me, but this is not within the limitation, this is not within the competence of me and my abilities, so I will not be able to counsel with you. But if you want, I can give you some names who are expert in these issues, so I can refer them to you. I can refer you to them. Okay. And fourth one is confidentiality. Clients must be able to feel safe within the therapeutic relationship for counseling to be most effective. This means that you will keep all of their information secret. All of them will be between you and your client, except actually, basically two situations. But first exemption is that if your client has a tendency to commit suicide, and secondly, if your client has a tendency to harm, to kill, to hurt someone else, then you can ruin the confidentiality and inform other people about the situation. Okay? But otherwise, what we talk with our clients stays within the session between us. And you will see some hyperlinks to do some further readings on these issues. Okay? And dual relationships are getting engaged in more than one relationship with a client. As I've said before, being both an ex-partner and a counselor, or you cannot be both a friend and the counselor of a person, okay? So these are dual relationships, having at least two roles of relationships. And under the code of ethics, we try to avoid these situations. And lastly, sexual relationships. Sexual relationships with clients are strongly prohibited. It's not allowed. In US, this is considered as a criminal offense. In Turkey, unfortunately, we don't have laws. And I know some of the professionals, I really hesitate to say professional to those people, but I know a man. Um, he's fond of himself because he's been taking psychoanalysis for years. He has been fond of himself that he's seeing some clients, but twice he slept with two of his clients, women clients. So this is never ethical and this is not acceptable. But as I've said, unfortunately, we don't have any laws. So you are not able to do something. So all these ethical issues are about you. So have your beliefs, have your ethical standards, okay? To be with the conscience in the field because we need it. Okay. Any questions about these ethical issues? Anything? Is everything clear? Let me see.
Yes, hocam. Thank
Okay,
you.
great. Thank you. You have written. So we've gone to the end of our ethics part. Then shall we? I think we can go on exactly directly, right? After maybe 20 minutes, we can give a break. Let's start Adlerian approach. Okay. Um, um, so far, we covered counselors as person and professionals. Today, we covered ethics, but maybe you quote and I reflected on it. What ethics cover is too much related to what we expect from counselors as a professional. And after this combination, we went on with psychoanalytic approach, and Adlerian therapy is the second approach that we are going to cover. Actually, my dear friends, um, psychoanalysis and Adlerian therapy, or so-called individual psychology, are considered under the umbrella term of psychodynamic approaches. Okay, but know that Adler was a follower of Freud and he actually firstly contributed a lot to psychoanalysis. But afterwards, his ideas, his assumptions about the nature of human departed from Freud's understanding. And he stressed on the unity of personality, indicating that people can be understood as integrated and complete beings. And he emphasized that instead of where we are coming from, as Freud stated, where we are going through is more important, he stated. He is distinguishing from Freud at this point. And he believed in the strengths and resources of people, and he said that people are creators of their own lives. And one of the most important terminology Adler developed was lifestyle, and he defends that people develop a unique lifestyle that is an expression of their life goals. So, in summary, people create themselves rather than merely being shaped by their childhood experiences and unconscious instincts, as Freud suggested. Okay, now we will go on with the key concepts of Adler. Firstly, to go through with view of human nature, um, Adler states that every people, every person has an ability to choose something. Everyone has a choice in life. But of course, when you choose something, you leave the other one behind, right? You leave the other option behind. So you should be able to take the responsibility of your choices and decisions, he says. And after doing this, you will try to create a meaning in life. And he defends that people are coming to life with feelings of inferiority. Hence, if I'm feeling inferior, then in life I will strive for success, completion, perfection, and superiority, he says. And according to Adler, being being after superiority is not something bad. He is not comparing um, him or herself with some other people. He says that if I'm feeling myself inferior at a point, in order to develop myself and to overcome that inferiority, I will try, I will do something, and as a result, of course, I will feel myself superior. This means that I will execute my own self. We are not interested in other people's progress, okay? And he stresses that we are motivated by social urges since we are social beings. And sorry, he states that every client has their own subjective frame of reference. This means that every people have their individual way in which they perceive the world. This means, according to Adler, now we are here, and if someone asks our perceptions about the world, about life, we will have very unique and distinct answers to that question. So, according to Adlerian perspective, this is called phenomenological. Okay, having a subjective frame of reference, and you will see that in our future theories, existential, person-centered, Gestalt, and reality therapies have a similar premise at the Adlerian. And thirdly, third key concept of Adler is unity and patterns of human personality. According to Adler, a person is a is like a unified structure, and a person cannot be indivisible. So all of our part dimensions are interconnected. So he holds a holistic view, and he states that we are not only driven by our instincts, our unconscious, and our early life experiences, early childhood experiences. Instead, he focuses on the impact of family, culture, school, and works. Okay, we have individual characteristics according to Adler, and they are shaped by our social environment as well. And according to Adler, as you see here, people are social, creative, and decision making beings who have a unified purpose in life. And as you see here, um, in Adlerian individual psychology, there is a focus on interpersonal relationships rather than on the individual's internal psychodynamics. To go on with the unity and patterns of human personality, individual psychology assumes that all human behavior has a purpose, and according to him, human beings set goals for themselves and act accordingly. Think about yourself. For example, maybe a year later, you will graduate, and maybe you put some and you set some goals for yourself and you are acting accordingly. Maybe you started working or studying for IS, KPSS, etc. He means these, we have life goals. And according to him, our human behavior is not determined. Remember our first slide when we were talking about psychoanalysis. Psychoanalysis was an approach which was deterministic. He was defending, Freud was defending that human behavior is determined by our instinctual drives and unconscious materials. Okay, but according to Adler, human behavior is not determined, rather, it is goal oriented. Maybe you can have a midterm question where you are asked to compare um, the theories of Adler and Freud, of course, in the form of a multiple choice question. Maybe I can give you a statement and I can ask you to um, find the answer where best Freudian and Adlerian approaches are compared, okay? So try to be critical. And again, to go with unity and patterns of human personality, as I've said before, Adler defends that we strive for significance and superiority. And this is for coping with inferiority by seeking mastery on a situation. And in order to understand human behavior, one needs to understand the idea of basic inferiority and compensation. So we experience inferiority and work toward superiority. And other construct for unity and patterns of personality is lifestyle. Actually, lifestyle is one of the most important concepts of Adler. And lifestyle refers to an individual's basic orientation to life. You can call it style of life, plan of life, strategy of life, or roadmap. And lifestyle consists of our perceptions regarding ourselves, others, and the whole world. And it is through our lifestyle that move through our life goal. So, in striving goals that have meaning to us, we develop a unique style, lifestyle. Now, actually, at the end of our lesson on Friday, I had given the example of Haluk Levent. Now, let's together elaborate on Haluk Levent's situation. Now, firstly, what you are gonna do is to guess his life goal. What do you think Haluk Levent's life goal is? What does he aim? Let me check chat. Helping people under grades. Thank you. Anyone else with any guesses? Okay. Yeah, helping people. Haluk Levent's life goal is helping people. So, in order to help people, what kind of a lifestyle he has developed? What kind of a, you know, we don't have the same lifestyle with Haluk Levent, none of us. What is his unique lifestyle? What has he done to help people to reach his life goal? Anyone? Like satisfaction, are you ask? No. Um, he has a life goal to help people, and in order to help people, how has he oriented his life? Just check out the lifestyle definition here in the slides. This is an individual's basic orientation to life, right? Our perceptions regarding ourselves, others, and the world. And we set up a way of life or a roadmap for our life. And what is Haluk Levent's lifestyle, strategy of life, plan of life, roadmap in this life? he has developed a unique lifestyle where he has been busy and running to the needs of every people, right? And he has a social interest in every other people's needs, and he has even formed an association for this. So his basic life goal is to help people, and to reach this aim he has formed an association where he can achieve his goal with the help of many other people. Okay, and he is running to the needs of other people whenever it's needed. This is his lifestyle, and Adler calls this social interest. Okay, okay, and just let me check your chat. I said, okay, Hande. And according to Adler, overall, humans are the creators of their life. This means that they are strong enough to be responsible for their lives. They are strong enough to choose for their lives. They are um, strong enough to determine some goals for their lives. For example, you can ask yourself, what is your aim in this life? What is your life goal? So, this may be a guiding question for you. And Adler states that no two people develop the same lifestyle. And to reach the goal of superiority, some develop their intellect, others their artistic talents, others athletic talents. So, overall, reaching the goal of superiority is an important achievement in our lives. And as we mentioned before, the styles of life consist of people's view about themselves and the world, and their distinctive behaviors and habits as they pursue their personal goals. And everything we do is affected by our unique style of life. And this lifestyle is generally shaped by the first 6 years of our lives. So, experiences within the family, relationship between siblings do contribute to the shaping of this lifestyle. But again, apart from Freud, it's not only the childhood experiences in themselves that are crucial, but the important thing from the eye of phenomenological perspective, it is our present interpretation of these events. Okay, do you have any questions so far? Okay, let's go on. Just a question here. And no, hocam. Okay. Thank you, Hande, for interacting with me. It's helping me a lot. Thank you, really. Okay. And social interest and community feeling. Actually, we mentioned about social interest, but let's make it definition. It refers to an individual's awareness of being part of human community and to the individual's attitudes in dealing with the social world. Remember that in our first class, I had told you to look around, to feel that you are a part of this larger community, because sometimes we forget in this very fast world where we are living and what's going on around us. So, social interest means having an awareness on being a part of this human community. And Adler defends that we are social beings and we are growing through a socialization process. And throughout this socialization, of course, we develop a sense of identification and empathy with the others. So, as social interest develops, it has been seen that individuals' feelings of inferiority diminished because as you start to look around, as you feel that you are part of this human community and you have responsibility for this community. And if you start doing something for this human community, then you will feel yourself unified and your feeling of inferiorities will diminish. Okay. And if you want to be happy and successful, it's suggested to be in social connectedness with outer world. Okay. And the fifth key concept of Adler is birth order and sibling relationships. Actually, Adler's this birth order and sibling relationship approach is unique in terms of giving special attention to the relationships among siblings and the position in one's family. And as you see, Adler identified 5 psychological positions regarding birth order. And considering that Adler's view human problems as social in nature, they of course emphasize intrafamily relationships. And of course, again, from the phenomenological perspective, instead of our actual birth order, how we perceive our birth order and how we uh, interpret it, it has more influence on our psychological state. And would someone be willing to read these Adler's 5 psychological positions instead of me, please? Because I got too much tired. You can just read it here. Anyone volunteer?
I can read, hocam.
Thank you, Beyza.
Okay, start from the Adler's 5 psychological positions, right?
Ah,
The oldest child receives more attention, spoiled, center of attention, hardworking when a sibling comes, no longer unique. And the oldest child is also busy, model child, and high achievement.
okay, thank you.
The second of, okay,
I will add some comments on this. If you are the oldest child, Adler states that you receive more attention and you can be spoiled. But when a sibling comes, you will not be unique anymore. And since you are the oldest child, you can be bossy or model the other children, and you can be expected high achievement. Okay. Okay, Beza, go on, please.
and the second of only two shares attention, behaves as if in a race, often opposite to first child.
Yeah. Okay, go on.
And the middle child is convinced about the unfairness of life, like poor me, peacemaker, and hold things together.
Great.
And the youngest child is the baby, pampered, grow their own way,
Mhm.
and like me. The only child is does not learn to share or cooperate with other children, learns to deal with adults, dependently tied to parents.
Thank you so much, Beza.
You're welcome.
And all of these and how we perceive these birth orders shape how we interact in adulthood. Just a second, only child cannot dethroned. What is dethroned, Hande? I don't know the meaning of that word. Tahtından edilemezdi. Okay, Throne, Games of Thrones. Yeah, actually, yes. They have like a throne, and if you are the only child, since most of the parents and families' concerns are all around you, you are pampered, and most of the focus of the family is on you. So I don't know if this answer met your question. Ben de bilmiyorum ama aklıma öyle geldi. Yeah, I think we can mention this only child as dethroned. Of course, it depends on how they again interpret and perceive their situations, and of course how they have grown in the family, in their family. But generally, they have such a situation. Okay, and in therapy sessions, of course, we don't have stereotypes for our clients. Okay, this client is middle child. Then, okay, I'm sure that she is convinced about the unfairness of life. She is having an attitude of oh, poor me, I'm very poor in this life, or she is always peacemaker. Of course, I will not have prejudices about our clients. Okay, we will take their histories in family constellations, but we will not have prejudices. But we will try to explore how our clients perceive and interpret their birth orders, and we will have questions on family constellation, and it will be more clear for you. Okay, and we are to go on with the therapeutic process. Now it's 7:50 in my time. Shall we give just 5 minutes break? Is it enough?
Okay hocam.
Okay, and after 5 minutes, we'll meet again. Okay.
Okay.
Okay, if you are ready, we can start. Actually, we can go on with the therapeutic goals. Yeah. Now we will talk about therapeutic process, but firstly, let's mention about the goals. And here, in a learning perspective, the most important thing is to be able to form a collaborative relationship. So what means the therapist and the client will work on this way together. And firstly, in this process, you will form a relationship with your client. And afterwards, you will investigate the lifestyle of your client as we investigated Haluk Levent's. Okay? In order to be able to investigate one's lifestyle, you should be able to have an idea about the goal of your client, okay? Life goal of your client. But sometimes clients may have some mistaken goals. They may not trust their power. They might not be aware of their resources to go on and to have a life goal, okay? Maybe they can think that they may have some irrational thoughts, and they may think that I can be beneficial for nothing. So this is a mistaken goal, okay? I have a goal, but this means that this goal is that I will be beneficial for nothing. So type of I don't have a goal in my life. So we try to identify and explore the life goals of our clients and how much these life goals match with the potential of our clients. Sometimes a client may have a life goal like I will run a kilometer in the competition in 5 seconds, and this is not possible. This is a mistaken goal as well, okay? We are trying to match their potentials with their probable performances and life goals. And in the cases our clients do not have realistic goals, we re-educate and reorient them toward constructive goals. And overall, the goal of the therapy is to develop client's sense of belonging to life and to assist our clients in the adoption of behaviors and processes characterized by community feeling and social interest. Adler tries to do this interestingly. He tries to develop social interest and community understanding in his clients. And to do this, of course, firstly, we increase the self awareness in our clients, and afterwards, in cases necessary, we challenge their life goals and sometimes encourage them to reorient their goals. And therefore, the process focuses on providing information, teaching, guiding, and offering encouragement to discouraged clients. And my dear friends, I don't know if you have gone through group counseling course, but maybe you have heard before. We have psychoeducational groups in counseling, and at school settings or in private practice, when you set up psychoeducational counseling, psychoeducational groups, most of the time, Adlerian approach can be utilized since in its nature there is this teaching, guiding, and offering encouragement techniques, okay? So we may utilize from Adlerian approach while preparing psychoeducational groups. And encouragement is one of the most powerful methods and techniques for changing a person's beliefs, okay, in Adlerian approach. And it helps build self-confidence and stimulates courage in our clients. And since when a person is discouraged, that person cannot function or cannot take responsibility for their own lives. So basically, clients in this approach are encouraged to recognize that they have the power, they have the strength to choose for their own lives and to act differently when change is necessary. And here, therapist's function is to help identify major mistakes in our clients. When we take into consideration these mistakes, for example, if our client defines him or herself as with lack of confidence, mistrust, selfishness, and with unrealistic ambitions and lack of, again, confidence. These are actually major mistakes, major mistaken perceptions and beliefs about a person according to Adlerian perspective. So, in cases our client holds such beliefs about him or herself, we as therapists try to help them to identify these mistaken and irrational thoughts, okay? And afterwards, as a therapist, we gather information about our client through family constellation, early recollections, or lifestyle assessment. And lastly, we will understand, challenge, and change their life story, and we will help them develop an alternative story. Please stop me where you don't understand or you have difficulty following, okay? And to go on with clients' experience in therapy, actually, clients generally do not realize their mistaken thinking patterns or behavioral patterns generally. So they have the responsibility and the experience in therapies to explore the views of self, others, and life based on a person's lifestyle, beliefs that get in the way of social interest, and that don't facilitate useful and constructive belonging. So, in order to develop a personal, unique lifestyle, in order to develop social interest, and in order to do something different than we have been doing, but not functioning in our lives, people try to change in the therapies. But as in every therapeutical approach, of course they resist to change because they don't know what to do differently, because they are fearful of leaving old patterns for new and unpredictable outcomes. And they may cling to old patterns even though they are unsuccessful. So they may resist to change. Here comes the role of therapist in terms of establishing that collaborative relationship. If my client has developed trust in me, then my client believe in me and in the process and him or herself. So afterwards, this resistance, you will see that will get softened. Okay, softened. And the relationship between the therapist and the client is based on cooperation, mutual trust, and respect. And actually, at the beginning of our sessions, we make a contract with our clients. We write a detailed explanation, description of what our clients want and how they plan to do this, how they plan to change. And we question what is preventing them from reaching their goals. And of course, in this contract, there is this that we will give information on how to change unprotective behavior into a constructive behavior, and we will lead them on how to make use of their strengths. Okay, in this contract, there will be their desires, wants, their plans, and the obstacles, and the ways to change, and the ways to make use of the strengths. And there are some phases in Adlerian approach. And in the first phase, we establish the relationship. As I've said before, it's a collaborative relationship. And we focus on the person, not the problem. And we work with assets and strengths rather than the deficits. And at this stage, we attend to our client, listen with empathy, and we identify and clarify our client's goals. In the second one, we make some interviews with our clients to explore their dynamics. And we ask our clients to tell their story and what about their coping strategies and the motivation behind their coping strategies. And we go through some family constellation, early recollections, and integration and summary techniques. What is family constellation? Okay, again, I need the support of someone to read this. Who can help me read this?
I can read, Hocam.
Thank you, Beyza'cığım. Okay.
You're welcome. Just reading the questions.
Yeah, exactly. Just read.
Okay. Okay. Family constellations. And the first one is who was the favorite child? And the second one is what was your father's relationship with the children, your mother's? And the third one is, which child was most like your father, your mother, in what respects? The other one is, who among the siblings was most different from you, in what ways? Who among the siblings was most like you, in what ways? And what were you like as a child? And the last one is, how did your parents get along? In what did they both agree? How did they handle disagreements? And how did they discipline the children?
Thank you, Beyza. Okay, as you see, at the second stage, in order to explore the individual's dynamics through the use of family constellation technique, we ask these questions to our clients. And as a second technique, we utilize from early recollections. We ask the three earliest memories our clients remember. And again, what part does the person take in the memory? Who else is there in the memory? What are the dominant themes? What feelings are expressed in these memories? And why did our client choose to remember that specific memory? Okay? What is our client trying to convey? What is the message he's trying to give us? In this technique, we ask these and we get information about the inner dynamics of our clients. Okay. And thirdly, third part is integration and summary. As a result of gathering information from our client through family constellation and early recollections, we develop an integrated summary of the data. We summarize the information we got from family constellation and early recollections, and we try to grasp the strengths and assets of our clients in all these stories. And as a result, we try to summarize the coping strategies of our clients in the difficult experiences he or she has gone through. And in this integration and summary part, you can focus on common fears of your clients, like our client may feel himself imperfect, vulnerable, disapproved of, and suffered from past regrets. We will identify these, we will grasp these and summarize them and reflect those to our clients. And in the third stage, we encourage self understanding and insight in our clients. Insight is an understanding of motivation in one's own life. And self understanding is possible when hidden purposes and goals of behavior are made conscious. And sometimes, as psychoanalysts, therapists may offer some interpretations to help clients gain insight into their lifestyle, okay, throughout the information they gathered. And the fourth stage is helping with reorientation and re-education. Okay, and here, so far, we discovered the inner dynamics of our clients, and as a result of this, we interpreted and we reflected back to their stories. And our clients' insight and self understanding has developed. Now it's time to put these insights into practice and action. Okay, so in order to um, put these insights into practice, we expect our clients to utilize from the useful side of life. This means to develop a sense of belonging and being valued, which will be accompanied by developing a lifestyle where social interest is active. If our clients take the useless side of life, they will withdraw from life tasks or they will avoid for protecting themselves. So at this stage, we encourage our clients to search for new possibilities for their behaviors or their lifestyles or their life goals. And acting as if is an important technique of Adlerian approach, and we ask our clients to act as if they are the person they want to be. And the second most important technique is catch yourself. So we ask our clients to catch themselves in repeating patterns in their lives. And we ask them to do something specific about their problem afterwards. Okay? And actually, we mentioned about this encouragement technique previously, so I will skip it. And other important technique is catching oneself, and this is habitual thinking styles or behaviors which are hard to change, and because they are with the client for a long time. So we want our client to watch out the situations where the problem behavior is most likely to occur. So again, is there some volunteer to read these cases, please?
Of course, hocam.
Thank you, Beyza'cığım.
Okay. I am both Sylvia and therapist.
Yeah, thank you.
Okay. When Alex starts to get angry, I just know that I am going to walk away into the bathroom and close the door. And the therapist says, you are aware that you start to feel scared and that you want to leave. And Sylvia says that it seems whenever he gets angry, I lock myself in my room. You might want to try this. When you sense Alex is getting angry, you might catch yourself and say something like, Alex, I sense you starting to get angry and I'm getting scared. Maybe we can talk this out and I won't go into the bathroom. Later, when Sylvia experiences an urge to leave the room, she catches herself having insight that she's about to leave the room.
Thank you so much, Beyza. This is a very good example of catch yourself, okay? And we utilize this technique in Adlerian approach a lot because if someone is able to catch yourself throughout repeating patterns, then this will be the first step that goes to self-awareness and insight. And this is the first step for change, okay? And the other important technique is using push buttons. We can call this technique as you are the driver technique, okay? This is including asking clients to imagine a happy place where they can feel comfortable and good. And then we ask our clients to imagine a sad place where they feel depressed and unhappy. What we aim in Adlerian approach is to show them that they have the control of their thoughts and feelings. Okay? They can wander around places where they can both feel happy and they feel sad. So ask yourself technique comes after using push button technique, and here we ask, does the situation itself makes you sad, or the thoughts you have about the situation make you sad? Okay, this is again a very much awareness provoking technique, my friends. And avoiding the traps, you will see that your clients will try to manipulate you a lot. And here, by avoiding the traps, we are trying to protect ourselves from our clients' attempts to manipulate us. Okay? As you see here, the patient says that, for example, this patient has a problem on thinking that everybody ignores her, okay? And she says that when new coworkers arrive at our store, I try to help them, but they tend to ignore me. And I notice that you ignore me and do not really listen to me when I talk about my problems. And the therapist says, you might like me to ignore you, right? But I'm not. And I want to hear more about things that are happening to you at work. Oops, I avoided the trap that my client did in order to manipulate me to make herself believe that I'm ignoring her too. Okay? I'm catching it. This is a very important technique. And the other one is spitting in the client's soup by a question or comment. The counselor changes the meaning of the behavior that the client is using for a particular purpose. For example, a mother who always says that she always sacrifices her money, her time for the sake of her children, and she is very fond of this. But actually, she wants to change this, but she's very fond of this, and actually, most probably, she doesn't want to change it. And here, we are ruining the game of our mother. And the therapist says that how unfortunate it is that you have no time for your personal life and your need for self expression. Okay, so this is a very strong technique. And lastly, of course, as each approach, Adler has some limitations as well. Actually, Adler spent his time writing his teaching his theory instead of documenting it. So he taught this to other pioneers, but didn't systematically document it. So this is a limitation. And some criticism focused that Adler's theory is simplistic. I don't know. And many of Adler's theoretical constructs, like social interest and lifestyle, are difficult to measure as the constructs in psychoanalysis. And as you see, there's a treatment efficacy and a treatment plan here, and there are techniques used in Adlerian approach, but research on this is limited as well. It was in Freud's approach. So you will see that after these approaches, we will consider CBT approaches, cognitive and behavioral ones, and they have evolved in opposition to these psychodynamic approaches, and they are very measurable. They are always after developing constructs that are measured objectively. So these psychodynamic approaches are criticized because they are constructs and are not allowing some empirical studies to be run on. Okay, we came to the end of our presentation, and yeah, I will upload Adler PowerPoint and the record. Busenur, I will see you later. Okay, now any questions? Anything you missed?
Hocam, the last soup technique, I think.
Huh.
I couldn't catch fine. Can you please give one example?
Of course.
More.
Şimdi I will share the screen as well. Okay, you will see that your clients will come to your sessions with some particular beliefs on their lives and on the meaning of their behaviors. Another example, just a second. Just a very recent example from my weekend couples therapy session. This couple just started 2 weeks ago, and in the first session, I saw them as a couple, and in the second session, I made individual sessions. And I was counseling with the woman, with the wife, and she had been saying that she was doing everything, she was accepting um, everything her husband offered and suggested. And afterwards, she was complaining about this. And uh, and one, she was also criticizing her husband about being too much manipulative. Just a second, something came out of chat. Okay, so later I will answer. And she was complaining about her husband, about his being too much manipulative. Okay, she was saying that her husband was always telling her what to do. But on the other hand, actually, she wasn't doing anything to decide and choose on her own. And she was saying that I'm always accepting what he offers to me. Okay? And as a therapist, you try to change the scenario and you say that uh, I see that you have forgotten your own strengths to be able to choose for yourself and to decide for yourself. Did you get it, Beyza?
Evet hocam. You mean the awareness. We need to
Exactly.
provide the insight of her.
Yes. Actually, all of these techniques provide insight. But when spitting in the client soup, actually this is trying to change thinking pattern of my client. Actually, she's mentioning about something like accepting what her husband wants every time as a favor. But at the background, actually, she is also complaining about this in under the umbrella term of I'm being manipulated by my husband. He always tells me what to do. But on the other hand, she says that I accept what he offers to me like a favor to the relationship and to her husband. This is like maybe you can think like the confrontation technique in principles and techniques of counseling,
Okay.
but the softer way. I'm not trying to show two separate parts of a situation to my client, but I take the other part and say, I I think you forgot yourself somewhere else. And maybe it would be better to remember yourself in terms of having your own decisions. Okay?
Yeah. Not offense. Okay.
Okay.
Okay. Thank you hocam.
You're welcome, Lisa. Any questions about the course content? Then afterwards, I will read your question, Hande. Hocam, I want to ask to you about our exam. What kind of questions may seem in the paper, as you said last class, because we are changing the questions format and my mind is confusing. No, we are not changing question format, multiple choice. All of the questions will be multiple choice. Okay? Maybe you got confused about I said that maybe I can ask you to compare Freud's and Adlerian approach. Maybe you got confused there. This comparison, this comparison will again be in the format of multiple choice. Let's say, just let me give you an example. Um, uh, let's say, in terms of the view of human nature. Which option below gives the best comparison between Freud and Adler? Let's say the true option is that while Freud thinks that human behavior is deterministic, Adler states that it's not deterministic, but it's interconnected among school, work, social life. Is it clear? You will choose the best option. There will be other options, which will be wrong, of course. You will choose this right comparison. Okay? You will not write a comparison, but you will choose it. Is it clear, Hande? Yes, clear now. Okay. Any other questions about content, about midterm?
Hocam slaytları bugün yüklemeniz mümkün mü acaba?
Tabii ki hemen I will upload them after our class. And I think I will be also upload the Zoom record as well. But it will take some time for Zoom. Anything else? Then I think we are very punctual and we can finish our class. Thank you for your participation. Thank you so much for your wishes. I will do my best to be with you on Friday. But if I'm not be able to, in such cases, I will at least connect you online. Okay, there will be an instructor there, etc. Okay, and hearts to you. See
Thank you,
you.
hocam.
Thank
See you.
you. Thank you. Bye bye.